Hi everyone, welcome to Madison YouTube channel. In this video, we are going to see about atrial septal defect. Atrial septal defect is an intra-atrial septum. It is common in females. It is a defect in intra-atrial septum. Intra-atrium means this is right atrium. Generally, this is heart, which is right atrium, right ventricle, left ventricle. In between the two atrium is known as intra-atrium. In there any defect in this closure of this atrium in the small ages which leads to this atrial septal defect. Here this atrium, this intra-atrium is made up of sinus venous type, ostium secundum, ostium primum. Due to these three improper closure in the small ages leads to the atrial septal defect. These are the atrial septal defect introduction and their types. Now we will see about the pathophysiology. The types are based on the three things, which is sinus venous type, which is the above one, and this ostium secundum and ostium primum. These are the three parts which are located here. Due to the improper closure of any one thing, it is known as the type of it, intra-atrial septal defect. Now pathophysiology. ASD allows shunting of blood from the high pressure of left atrium to the low pressure of the right atrium. There is high pressure is in the left atrium. From here, the blood goes to the right atrium. Due to here is high pressure and the right atrium has low pressure, the left atrium transfers the blood to the right atrium. From the right atrium, it goes to the right ventricle. Hence, there is increase in the right ventricular inflow. From right atrium, it goes to there is increase in right ventricular inflow. The right ventricular output and the pulmonary blood flow is also increased. From here, that is pulmonary output is given, blood flow is out is given. So from the right atrium to the right ventricle, there is pulmonary outflow and the pulmonary blood is flown outside. Increased pulmonary blood flow give rise to the increased pulmonary vascular resistance and the pulmonary hypertension. When there is increased pulmonary outflow, this creates the pulmonary vascular resistance and pulmonary hypertension. This creates the pulmonary vascular resistance, and this usually happens above the age of 30 years. The severe pulmonary hypertension may lead to the increased right arterial pressure, which can be more than left atrium and leads to the right to left shunting with central cyanosis. Severe pulmonary hypertension may lead to increased right arterial pressure, which can be more than left atrium and lead to right to left shunting with the central cyanosis. These are the pathophysiology. When there is severe pulmonary hypertension it increases the right arterial pressure, which can be more than left atrium and lead to right and left shunting and which causes central cyanosis. Due to the pressure here it is more, it again changes from here to left atrium. This causes the central cyanosis and this is known as right to left shunt. Because of the increased blood flow into the right side, the right atrium and the right ventricles get dilated and thereby make atrial arrhythmia, especially atrial fibrillation. There will be the blood flow from the right side is more. Due to that, the right ventricles and the right atrium gets dilated. Due to it forms the atrial arrhythmia. Atrial arrhythmia means irregular beating of the atria, and especially atrial fibrillation. The symptoms, the clinical features of this are, the symptoms are the children with ASD are asymptomatic, but as they reach the third decade, they may develop pulmonary hypertension as explained above. Children in the atrial septal defect are mostly asymptomatic. As they reach third decade, they may develop pulmonary hypertension as explained above. The dyspnea and the weakness occurs due to the pulmonary hypertension. Dyspnea, difficulty in breathing, and the weakness occurs due to the pulmonary hypertension. Recurrent respiratory infection are common to the increased blood through the pulmonary vasculature and the congestion. Whereas recurrent respiratory infection are common to the increased blood flow through the pulmonary vasculature and the congestion. These are the symptoms of the pulmonary atrial septal defect. Are the prominent pulmonary artery pulsation is seen due to the blood pumps from the left atrium to the right atrium to the right ventricle to the pulmonary artery. Due to that, there is prominent pulsation is seen. There is more blood flow to that. There is pulmonary hypertension, so there is pulmonary pulsation is seen. prominent pulsation. On auscultation, the second heart sound is widely split and fixed in the relation to the respiration. The right heart failure may develop and may lead to raised JVP. Due to the right heart failure, they develop the raised JVP, jugular venous pressure, and peripheral edema. The development of Eisenberg syndrome leads to central cyanosis and digital clubbing. The hands, the fingers, the digits which are present in the hands gets clubbed, as well as central cyanosis happens. Complications of this atrial septal defect are congestive heart cardiac failure, pulmonary congestive cardiac failure, pulmonary hypertension, infective endocarditis, atrial fibrillation, and paradoxial embolism. Investigation on chest X-ray shows prominent pulmonary artery. There will be prominent pulmonary due to the dilation of the pulmonary artery, pulmonary vasculature congestion. It may show right atrial and right ventricular enlargement. There is right atrial as well as right ventricular enlargement as seen in the investigation. In ECG, there is right vascular hypertrophy and dilation. In echocardiogram, shows right ventricular hypertrophy. There is right ventricular hypertrophy. Enlargement of the right ventricle is seen and the dilated pulmonary artery is seen. In cardiac catheterization is also a investigation. Treatment. Surgical closure should be done between the 6 years of the age or soon as the possible in significant AST. The surgical closure should be done between 3 to 6 years of the age, or it may develop into atrial septal defect in the third decade, so it is too hard. So we should do a surgery in 3 to 6 years of age. That's all about the atrial septal defect. Thank you. If you like this video, please like, share, and subscribe my YouTube channel. If you have any doubt in it, please do comment it. If you want more videos, please do subscribe. Please do suggest any topics in the comment box. If you want this notes, please do follow my Instagram page. I will provide the notes there. Thank you.